I'm Joe Chili. You can listen to me mornings on the Big Wack. Joining us today on the Big Wack Buffalo on the Rise is Paul Gladowitz of the VA of Western New York Healthcare. Paul.
Hi, Joe. How you doing?
Nice to see you today. Thank you so much
too.
for being here. You know, we want to talk about connected care at the VA, and you know, I think when we start talking about virtual health and things like this, we have to make sure we explain to people because they're going to want to know whether they have the proper equipment, how they go about doing it. But let's talk first about what connected care is at the VA.
Well, connected care combines the services and the tools that we offer veterans so that they can contact their providers and they can communicate, get access to different services in the VA that allows them to communicate with them. So basically it's different types of virtual tools such as video conferencing, which is the VA Video Connect that we have. Also My Healthy Vet, which is a informational database that veterans can go into and sign in and look up their records, look at lab results, get results on pharmacy refills and results on lab tests they've had, and also use it as a medium to communicate with their provider if they have a general question.
Is it kind of like a virtual portal?
Yeah, it is. It's a virtual health portal that they can communicate with their providers. It gives them better access to the providers. I know sometimes our veterans get frustrated when they try to call into the VA and get a hold of their primary care team, and they get switched from one department to another. So this makes it an easier way to get better access with questions you might have with your provider.
Can the average individual, whether they have a computer, laptop, whatever the case may be, smartphone, is it easy for them? Do they have to have, you know, kind of extensive equipment to get connected?
Well, it's gotten a lot better from pre-COVID days. When we first started this, it was a very clunky system, and the VA has kind of grown all its own tools. COVID really gave us a starting point where everybody had to do things remotely, so things were developed, and it's much more user-friendly than it used to be. And as far as the things that the veteran needs is they can, like you said, use their smart devices, a computer, laptop. But even if they don't have access to those devices, the VA can work with them to get them access to it. We have a tablet lending program. We have not only clinics located throughout Western New York that they can access to use telehealth tools to contact their providers and still be able to participate in clinics that might be hard for them to get to up to the main facility.
And they can feel comfortable that their information is secure on these.
Yes, everything is operated through a secure and encrypted portal. So it's not like anything is going to end up on the internet. It goes through the VA security system. So yes, it is a very secure system.
Many times, you know, when you're using whatever it might be, if you're at a doctor's office or things of this nature, you're going to give blood, you know, you'll get like an exit interview. You'll get like a questionnaire after the fact that'll say, you know, how long did you have to wait? Were you satisfied with this? What kind of response are you getting from this virtual connection from the veterans themselves?
Well, we're finding that the VA, the veterans really like the virtual connection. As a matter of fact, we did a recent survey, and it showed that compared to even face-to-face, 42% of our veterans liked the virtual better, whereas 32 preferred face-to-face, and phone call was around 15% of those surveyed. We also are constantly surveying our veterans on the quality of the care that we're providing through these telehealth and these virtual means, and we have a very high 92% satisfaction rate for the virtual tools that we're using. Like I said, since COVID, this has developed so far that it's got a lot clunkier, easier for the veterans to use, and we continue to take steps to improve that. And one of the steps that we are taking to improve that is we will be opening a virtual health resource center at the VA in Buffalo. And this is an actual training center that our vets can come up to and get a one-on-one with a person if they are having problems with their device, either a smartphone or a tablet, or if they have questions about My Healthy Vet. We offer a number of VA mobile apps that are used by our veterans. If they have any questions on that, we can go through it with them. So we haven't had this before, and I know one of the biggest issues that we've had with getting veterans to use this is overcoming that fear of the technology, of using their computers and using the software to access their providers.
All right, we only have about a minute left or so, but you're helping this people that are in rural areas. Are you feeling good about them being able to connect as well?
Yes, in the rural areas, we've done a lot of work there too. We have a program called Atlas, where our system is the only one in the state to have an actual telehealth site located at the post in Gowanda, where veterans can go to and do their sessions. The Virtual Health Resource Center is another, and also the Digital Divide program I had mentioned before, where we do lend out tablets to veterans that have cellular plans on them so that they can contact their providers.
All right, Paul, this has been very informative. I appreciate that. For more information and answers to your questions, contact VA of Western New York Healthcare System by calling 716-862-7886 or go to buffalo.va.gov. Sponsorship and promotional consideration for the preceding segment was provided by the following.